Welcome everyone to today's Project Aware session entitled Well-Being, a Multi-Systems Framework. So with that, I will go ahead and I will pass it on to Miranda March to get started.
Thanks, Joanne. So this is our standard disclaimer. Now that we're in year 4 of the initiative, I'm assuming that everybody is pretty familiar with the overarching objectives and the way that the Now is the Time funding is organized, introducing Lyman Legters. Along with that, he's been with the Casey Family Program since 2002. From 2012 through 2015, he worked as a senior fellow at the U.S. Department of Justice, where he worked on violence prevention, juvenile justice systems reform, eliminating racial disparities, and cross-systems alignment and coordination. In 2016, Lyman became Casey Family Program's strategic consultant for the states of Michigan and South Carolina. He's also worked for 20 years in various roles in Seattle's juvenile court system. This is a man who has a breadth and depth of knowledge in the field of youth wellness, and that he is here to share some of that with us today. So with that, I will turn it over to Lyman.
Thank you, Miranda. Appreciate the introduction. Well, good afternoon, good morning, everybody. It's really a pleasure to be here with you. I am excited to share some work that I've been involved with for the last 3 or 4 years in conjunction with the Youth Transition Funders Group. And in looking at the overarching goals of Project Aware, especially as you look at improving the outcomes, equity, and cross-systems alignment for the vulnerable children and families that we're all concerned about and interested in. And really hasn't gotten, I think, the level of attention, level of investment, and level of resource behind it to really see well-being as more of an overarching frame. And I'll talk a little bit more about that as we get into the framework. We think that this idea of well-being can actually support cross-systems opportunities. We've looked for ways to intersect across systems, build bridges across systems in many different ways. I've done a lot of the work on cross-systems alignment between child welfare and juvenile justice. And we think actually that well-being could be a catalyst to that across multiple systems. We think that that notion translates across systems better than other language. And if we look at the outcomes from multiple systems, we really are all driving towards this idea of well-being. We really want to consider wellness and healing as collective goals, and I think from the little I know about Project Aware, quite sure that that notion resonates with you all. And then we want to think about children, families, and communities collectively, but also from a life course perspective, not just from a point in time or circumstantial perspective. We really are hoping that this notion of well-being will have us as professionals, us as systems, thinking about how we are not just changing the current circumstance, but actually impacting a long-term view of the children, families, and communities that we're working with and working in. So I hope that comes across in the presentation. We've done introductions already. It's nice to meet you all. I'm going to spend a few minutes talking about the science that's behind this notion of this expanded notion of well-being, and talk a little bit about the federal investment during the previous administration and how that kind of was the catalyst to broader thinking about and developing some priorities around well-being. And then I'll present the well-being framework that the Youth Transition Funders Group published now, I want to say 3 years ago. I think it's about 3 years old, and that's the PDF that you all have a link to in the email that Joanne mentioned. And then I hope that we'll have time, I'm quite sure we'll have time to engage in dialogue. I would love to hear your questions, your thoughts. The Adoption and Safe Families Act of 1997 really drives a lot of the work at the federal level and across the states in child welfare. And clearly safety and permanency are paramount to child welfare. The child welfare system exists to respond to harm that's caused to children by neglect and abuse, and really safety can't be ignored, can't be overlooked. Permanency is really the outcome that we're driving towards in all these systems. And understanding that that's going to be there and it needs to be there, but we think that we can talk about it from a context of well-being, and again, that will come a little bit later. Foster care is a temporary setting. It's not a place where children should grow up, and the work that we've done at Casey Family Programs over the last 12 or 13 years, we've really driven this notion that we need to minimize the time that children are actually in foster care and move them either home, which is the preferred option, getting them reunified with their families, or into a permanent family setting, whether that's through relative care or adoption. So we just, again, this notion that foster care is the answer, it really is a temporary setting. There's no evidence base behind the foster care, and so we just want to make sure that that's a piece of the discussion. Permanency planning efforts are continuous throughout the child's experience in child welfare. The child welfare system has to focus on results and accountability. And finally, the federal funding should be used to promote safety, permanency, and well-being. And frequently we don't see the investment of federal funds in well-being support for children that are in the foster care system. There's been some movement on that. There's been some flexible funding released through 40 waivers. There's plans for more flexibility in federal funding for child welfare if and when, or maybe let me just say when, our Congress passes the Families First and Prevention Services Act. So we're looking forward to that, and hopefully that will increase the amount of investment that we see in healing and wellness for children impacted by the foster care system. This work was done under the leadership of Brian Samuels when he was the commissioner at ACF, and the Children's Bureau took on much of this work. So they really started with this notion of research and science, building their evidence on science, using data to show the need for increased focus and expanded thinking around well-being, developing a really clear message and repeating it over and over and over again. So they use the message with their public child welfare partners across the states consistently for over a period of time. The well-being areas that they identified at ACF, they really made measurable. Now, this is going to be an issue that we have to talk about more because measurement of well-being is still a little bit, there's work to do on developing really accurate measures of well-being, especially as we expand the thinking across systems. So it's a place where YTFG is still working and thinking about how we improve that. Definitely engaging partners, finding champions. That was something that our federal partners did and focused on. And of course, within YTFG, we're doing the same thing. We think that it's important for us to think about this collectively. The federal government was able to use policy and fiscal levers during that time. And as we all know, the environment within the federal government is different now than it was then. So we haven't even really talked about how this notion applies in the current administration. ACF really focused on connecting the dots and letting folks know what the costs were in terms of investing in well-being, but also what the cost benefits were if we were successful in improving well-being outcomes for children, families, and communities. Lots of science. Now all of this will resonate with you, I think, understanding child development, the developmental sciences, early brain science, adolescent development, all of those things that we're learning so much more about over the last decade. Certainly the work on ACEs and trauma, toxic stress, brain science, and epigenetics. That's a big word. I think I actually learned the meaning of that word when I presented this at the Project Aware conference a month or 6 weeks ago, understanding that there's generational impacts to the trauma that children and families experience. So building on the science to inform well-being priorities. Now, they're part of the science that ACF and the Children's Bureau really focused on and brought to the forefront. We certainly built a lot of the well-being framework around the notion of resilience and what we knew about the power of resilience, how amazing it can be. One of our participants in the development of the framework is a gentleman named Tony Biglin from the Oregon Learning Associates, I think. He wrote a book called The Nurture Effect, which is really a powerful piece of work on resilience in young people. Creating domains of well-being, so going beyond what we've known historically in child welfare as the kind of three areas of well-being being education, mental health, and employment, but really looking at a life perspective and creating significant domains, and I'll show you a good schematic of that as we get into the framework. Making sure that we were looking at screening, assessment, interventions, all those things had evidence base to them, and you'll see some of that built into the recommendations that we presented in the framework. And then a real powerful motivator for this work at the federal level was an understanding that in so many cases in our child welfare system, psychotropic medication is used to control behavior and deal with issues that are much more deep-rooted than medication can really respond to. And so we really wanted to see how the notion of improving attention to and investment in well-being could mitigate how the use of psychotropic meds on kids that are in care, and largely acting out because of the environment that we're putting them in, not because they have some kind of organic issue that medication can somehow solve. And looking at the science, this is a slide that shows how disintegrated, how fragmented the science is around different areas of to kind of visualize the systems that are touching children and families, because you can see that they touch each other, but they're not necessarily aligned. And our hope in this work is that they will somehow, that we'll move towards better alignment, really seeing how the science can align across these multiple disciplines, these multiple systems, to create and operationalize the well-being framework and ultimately promote well-being of children and youth. And this is involved in the child welfare system. I use this with multiple systems, so it's really promoting the well-being of children and youth that are involved in any system that's serving them. The messaging that came out of ACF was really powerful. They really pushed this notion of well-being to a place that I personally had not seen it before from our federal partners, but really using their ability to message across all 50 states and the territories, using their influence to our tribes, our tribal partners as well, but using their influence to elevate this notion of well-being. And saw a fair amount of momentum on this, but this is a schematic of how we think, or at least how our federal partners think we can look at measurements for well-being. And if you look at the top light blue set of boxes, infancy 0 to 2, you can see that there are descriptions of outcomes or things that can be measured based on the different domains that are listed at the top. So looking at environmental supports for infants, does the family have the right resources to raise and nurture that young person? What are the characteristics of that child? Are they having any kinds of temperament or cognitive issues that need to be addressed? Functioning, cognitive functioning, are they developing at the right pace? Physical health and development, making sure that we're looking at the standards for growth and development and measuring those over time as we're working with young people and families. Emotional and behavioral functioning, are they able to manage themselves? Are they expressing the right level of emotional and behavioral functioning based on the things that are listed in that box? And then social functioning. And these, again, are the domains that our federal partners came up with. You'll see a slightly different set of domains in the Youth Transition Funders Group Wellbeing Framework. So this is just really, for me, an example of the fact that we can actually measure well-being if we spend a little time thinking about what it is that we believe helps children, families, and communities become well. And so that may be, we may be at the front end of that right now. This is a kind of flow chart where they put all the information together around screening tools, assessments, functional assessments, how that goes into case planning for safety, permanency, and well-being, and then eventually realizes better outcomes in those three areas. So now I'm going to shift to the actual well-being framework from the Youth Transition Funders Group. So this is the YTFG, as you can see on this slide, is a learning community of about 100 funders where we were brought together, I want to say it's 20 years ago now, by some of the major foundations, NITT-TA, Casey Family Programs, the Conrad Hilton Foundation. There's a number of big ones, but they're largely made up of smaller local funders. But it came together really to kind of align thinking across this older youth population and what we were doing, how we could align our work in support of healthy transition out of systems for young people who are in those systems. Let me just add one caveat that while this framework is developed from that lens, because the YTFG is largely made up of funders that are funding in the older youth space, I firmly believe that the framework that I'm going to share with you actually applies across multiple age groups. There may be a need to do a little bit of translation, a little bit different thinking, but the notion of this idea that well-being can be an umbrella frame doesn't apply just to older youth. So YTFG is structured in 3 work groups. There's a foster care work group. The second one says multiple pathways to graduation. That's now actually an economic well-being work group. And then the third one being a youth justice work group. So you can see that it's kind of structured like our systems, and I frequently question that myself. Why are we structured like the systems we're trying to change? But it's pretty effective because this is the way funders align themselves. We don't see many funders that cross those work groups. They're usually organized in that fashion, so that's the way YTFG is structured. We looked at some data. These are just some high-level data points that we were interested in and looking at when we began the conversation about expanding this notion of well-being. You can see that almost 6 million children between the ages of 16 and 24 are not in school or employed. Over 100,000 children between ages 14 and 20 are in foster care. And if they're that old in foster care, they're more likely to transition out of foster care without a permanent living arrangement. And then 61,000 young people under the age of 18 are incarcerated in our youth justice system. We came together and actually following the lead of ACF, YTFG published a well-being guide for children in foster care, for youth transitioning from foster care. And it was at the release of that report in 2013 that became the catalyst for the framework that I'm going to share with you, that I'm sharing with you today. So it was at this meeting where we were talking about the components of the well-being framework for youth transitioning from foster care that a colleague, and at this time I was at the Department of Justice working on various reform efforts, and a colleague looked at me and said, well, Lyman, we need one of these for youth justice. We need one of these for our juvenile justice system. And I wish I could tell you that I had this like really deep and profound and scientific, complex response to that. But I looked at her and I looked at the framework and I looked back and I said, what would be different? So it was really starting this notion of a cross-systems approach to well-being with a question. When we start thinking about well-being, it's not well-being for children in foster care. It's not well-being for children in our juvenile justice systems. It's well-being for children. And it doesn't matter where they sit or how they enter or come to our attention, wherever we're sitting in the system, well-being is something we should be striving towards. And it doesn't change. The components or domains of well-being don't change from one system to the other. They're really based on child and adolescent development and what we know about how we can nurture and grow healthy, productive, resilient children and families. So we really then decided that it was incumbent and something that we could actually take on was to bring together a group of people from across fields, from across systems, and develop a framework, develop something that we thought would be relevant and useful to the field and something that could actually help improve outcomes for children across multiple systems. So we brought together about 40 people in New Orleans. Several of them were funders. We had some content experts from various fields. So we did bring in Brian Samuels and Claire Anderson, who had been at ACF and helped with the development of well-being from the federal child welfare perspective. They were both by then had left the federal government and were and are now still at Chapin Hall at the University of Chicago. Brought in Tony Bigman, as I mentioned, who wrote the book, The Nurture Effect. We brought in, for those of you who know about the work in risk and protective factors from the juvenile justice system, Hawkins and Catalano were some of the early pioneers in that risk and protective factor work, and so Rico Catalano was able to join us for this conversation. It was really fascinating. We had folks from the Centers for Disease Control and the youth violence prevention work. We had federal partners from OJJDP. And so we started with creating a statement of principles and values, and I'll share that statement with you or just share with you a list of the values that we really thought we were operating from. We ended up drafting the framework in that conversation, and it was later then refined and written into the published form that you can see on the PDF. But we spent 2 days really banging out what we thought this framework ought to look like. We created a set of recommendations. I'll share a list of those as well. And then as I said, the YTFG then synthesized that back into a full draft for publication. And it says we drafted the expanded 2.0 version. We're actually, YTFG is actually working now on what the next iteration should look like. There's a couple things that I'll share in a moment when I go through the domains. There's a couple of things that we found that we missed in the early framework, and then we really want to talk more about how these notions are applicable and an ability to implement or use this in policy, practice, cross-systems work across multiple systems. We really want to know and share more about applicability and utility of these ideas. These are the principles and values that we started with. We believe that all young people are valuable. None of them should be thrown away. They all have value, and we just need to operate from that principle no matter where they are or how they came to our attention. We have a value of equity. Equity being a broad notion, including racial equity, gender equity, sexual orientation, immigration status, all of those things that fit under that equity lens. And we actually built this framework kind of on a pedestal, and you'll see in the graphic in a few minutes that we set the idea of this framework on a notion of equity. And we actually have done a fair amount of work over the last couple of years merging this notion of well-being and equity into our thinking and our presentations at our gatherings. And I think the next step for us will be to actually write more about it, put something into publishable form. We believe that young people need to have a voice and have a say in what happens to them. Even at the earlier ages, while this was written for older adolescents, this notion of agency is something that we need to be focusing on for all ages. And it may not be the actual child's voice, but who's advocating for the child and making sure that there is someone or some voice there for the child's interest to be promoted in the work, the case planning, the resource provision, and so forth across systems. We believe that anything we do, it must be developmentally appropriate. A lot of this is built on, obviously, the science in early childhood and adolescent development, but a lot of it's also built on a publication that was released 5 or 6 years ago by the National Academy of Sciences that really talked about how we needed to reform our juvenile justice system from a developmental perspective. We believe in a notion of normalcy, that what we do needs to create a sense of normalcy around young people, that they can be children. They have a chance to be children and experience the things that go into quote-unquote normal childhood, adolescent time, so that it's not all focused on the issue or incident that brought them to our attention. We think that we have to focus on the whole person. We can't separate a child, pieces of a child, or even pieces of a family from the whole, right? So I think this is, again, a notion that we have to, wherever the child or family is entering or sitting with us, we have to be responsible for the whole person, not just a piece, not just a circumstance, but making sure that we're attending to the full development and whole picture of the child and family, and ultimately community that we're working with. Family is a huge value. Family needs to be a clear focus for any work that we're doing. We just need to do more with that. They need to be involved. We need to focus on making sure that children have healthy families to live in, and it doesn't necessarily mean that that's a typical, two-parent household or a typical standard of a family, but what does it mean to the child? What does it mean for them and for their healthy development? We believe that young people are all redeemable. Families are all redeemable. And so really making sure that we're not building in collateral consequences for incidents, circumstances that brought children and families to our attention, but that we do believe that they can be redeemed, that giving them second, third, fourth, fifth chances is okay. If we see hope, if we see promise in what can happen, that they can be healthy and become well. And then making sure that we have all the due process protections in place for what happens with the children and families, that their rights are protected. We spent some time really talking about the workforce, so making sure that in this work we contemplate a healthy workforce, understanding the secondary trauma that happens across multiple systems, to people who are working with vulnerable populations, but making sure that we're including them in the thinking, including them in the voice, and contemplating a healthy, strong, and vibrant workforce in support of these vulnerable children and families. We believe in a science-based, while I wouldn't say that we are strictly focused on evidence-based, because that requires a whole nother level of scrutiny to drive towards evidence-based. There has to be some science connected to the work that's going on with the children and families, and so making sure that there's at least promising practice being applied, and that there's some evidence that whatever intervention, assessment, screening tool, whatever we're doing has validity from a science perspective. Communities are very important. You'll see in a coming graphic that we believe that a healthy community has to be a focus of our systems, because the children and families live in communities, and we can't ignore that. We can't assume that we can, first of all, replace community, but second of all, it makes no sense for us to work on vulnerable children and families in a controlled setting and then put them back into an environment that we haven't spent some time or invested something in so that they're not exposed to the same things that brought them to our attention in the first place. So we define well-being as a satisfactory human condition characterized by health, happiness, and fulfillment. We also spent a lot of time talking about this and determining that it's not a measure that we somehow magically achieve and then maintain for the rest of our lives. In fact, I'm a little bit older, so I've been going through some issues with my back over the last couple of years, and I can tell you that I am focused on this notion of becoming well personally, and so it really resonates with me that we need to not think about, we need to think in a broader perspective about what we're trying to accomplish with children and families. And even a better term for this process is well-becoming. So what are we doing to invest in this notion that we're helping a child or a family become well? Again, not thinking that this is somehow something that we can achieve at some point and then stay in that kind of place forever. So I'll be interested in your thinking or your comments about that notion that this really isn't about achieving a state of well-being, but it's really more about how we're investing in the ability of the child and the family to become well. These are the well-being domains that we put into the well-being framework: cognitive development, social and emotional well-being, mental health and wellness, physical health, safety, and economic well-being. The one that we missed that we intend to include in the next version is one around spirituality. Not quite sure how that's going to be defined. It's not necessarily religion, but there is a piece of domain around spirituality and kind of self-awareness and so forth that we think needs to be included in this framework. And I will say, too, from that you can see descriptions of each of these in the framework. I want to just point out that safety in particular is not just safety from abuse and neglect, but it's safety in community, safety from violence. Again, looking at these domains in the broadest frame and across multiple systems. This is early schematic. We believe that healthy young people exist within the context of healthy and nurturing families, and healthy and nurturing families exist within the context of a strong and nurturing community, and that those of us who work in public systems should be supporting that arrangement. So wrapping the systems around this community, family, young person dynamic and making sure that we're supporting that arrangement. And then that ultimately led us to the schematic that we use for the actual framework. So you can see that we have each of the 6 domains around the center, and you can see the healthy young person in the center of that, surrounded by a nurturing family, surrounded by a community, a strong and nurturing community, and then those of us that are working in the public systems around that, supporting that arrangement. And then you can see at the bottom of that we believe that equity and inclusion is really the pedestal for this framework for these domains. So why well-being? Lots of people have asked. I mean, I remember when I was in the Department of Justice, and we were talking about this notion of well-being, and I would talk to people who were focused on juvenile justice and talk about well-being, and it's like the response was, what do you want me to be, a social worker? And like, wow, okay, that's an interesting response. So how do we frame it in a way that well-being resonates across systems and for all folks that are working with vulnerable populations? We think it's a unifying concept. If we talk about safety from an abuse and neglect perspective, it's very hard to engage outside of the child welfare system or child protective services more specifically, and folks who come alongside and support either responding to or preventing abuse and neglect. That's a CPS function. That's a child welfare function. So when you talk about safety in that context across systems, it's really hard to get people to buy in and see their role in supporting that in the response or in preventing it. But if you shift it to a well-being focus, we believe that we can actually see or translate well-being across systems. If you pull out the risk and protective factors from juvenile justice, they all connect directly to well-being. I believe the same is true, that we can do the same thing for the education system. We can do the same thing for mental health, behavioral health, the other systems that are touching children and families. We think this concept will bring systems together, and it effectively translates across systems. If we frame our various outcomes in this notion of well-being, we think it really does translate well. It translates better than anything else we have, so that's our notion anyway. We've already shown that narrow, uncoordinated, siloed approaches don't work. Staying inside our systems, having this kind of siloed structure, just hasn't been effective. And we think that creating a stronger sense of alignment, intersection, integration across systems will have better outcomes for the children and families that we're serving. It allows us to shift our focus from transactional work to transformational work. Our CEO at Casey Family Programs frequently asks us, how are the children? And in order to get to answering that question, that our children are well, we think that requires transformation. We can't stay within the current structures and the current policies and practices, which essentially are transactional, if we're going to see the kind of systemic reform, systemic change that we want to see. And so we think that this notion of well-being gets us to a transformational place. Well-being aligns with science, best practices across systems. It really sets healing and wholeness as the goal for all systems serving children and families. So we really think that, not only can we link it to science and best practice, but it changes our focus. It's not just fixing a particular circumstance, responding to a specific trauma, though all of that happens within the context of well-being, but it really sets us on a much stronger focus towards healing and wholeness for children and families. So we have a set of recommendations. I can't remember if I pulled out all of them or if this is a sample, but they're much more deep in the framework, and then we're going to add some to these as we introduce the next iteration of the framework. You heard me mention our value around youth voice and agency. We think that engagement with youth and family is very important, that we've got to not just create space for them at the table, but we really have to authentically engage them in decision-making and helping them advocate for themselves and really help them tell us in the systems what we need to change, what we need to improve in terms of policy and practice. Systems have got to have an intentional focus on eliminating disparities and outcomes for young people of color. A lot of work is on this across different systems over the last couple of decades. We have seen some progress, but not the kind that we think not the kind that we want to see, but we think that if we can align ourselves across this notion of well-being, that will actually help us think about disparities from a multi-systems perspective, because too often the focus on eliminating disparities happens within the context of the silo that we're operating in, and I frankly believe that disparities in one system impact disparities in another system, so we have to look at it from a collective view, collective perspective. Not only do we have to do new things, but we got to look at the things that we're doing that aren't getting us the results that we want. So we have a recommendation about deconstructing harmful policies and practices that are inconsistent and incompatible with well-being. A great example of that is the current movement around de-incarceration of youth youthful offenders, and how we need to think differently about how we respond to juvenile crime. The use of residential care, the use of incarceration doesn't really get us the outcomes that we want for children. And that obviously is contextual and needs a whole lot more work than just that simple phrase, but that's an example of where we need to examine the policies and practices that we use and really make sure that they're not things that we're using just because we always have used them, or there was some reason that we used them in the past that no longer exists, but making sure that they're getting us the results that we desire for the children. Proactively improve policy and support to support well-being. So how do our policies align with this notion of well-being from whatever system we're sitting in? Improve, expand, and sustain innovative and evidence-informed practice, again, to support well-being and identify youth populations within youth-serving systems and really engage in cross-systems alignment. There's a lot of work that's happened, and I know that that's part of what Project Aware is about, really, is looking at cross systems, mental health, education. A lot of the work that I've done over the years has been on the intersection of the alignment between juvenile justice and child welfare. While we've seen lots of really good ideas and pockets of success, we haven't really gotten to a place where our systems, large scale, are aligned and coordinating with each other. Support professional development for those who work with and care for youth. This is again a place where we've got to elevate our workforces across all disciplines, across all domains, and make sure that as a country we're investing and we see the work of developing strong workforces as investment in the future, in our children and in our future, and not as costs or budget items that can be cut when there's difficult decisions being made, but really support professional development across these systems. Create supports within the community that promote well-being. Again, this notion of investing in systems coordination and alignment shows up again. Investing in research and evaluation. Always need to not only know where we are, but know how we're progressing. So making sure that we're capturing data and evaluation measures. Developing effective financing strategies to support implementation of well-being. Now, I will say that this recommendation was proposed at a different time. I think that we were thinking more about federal investments in this notion of well-being. We haven't necessarily given up on that, but I do think that, again, the environmental landscape has changed since we developed this framework. So I think that our strategy now is to really focus on how we can influence local jurisdictions to consider this notion of investing, of creating financing strategies that improve well-being and ultimately realize better outcomes for children and families, but also cost savings for our public systems. This is a picture of the first time, and I'm going to share this story as kind of how I make a personal connection to this notion of across systems focus on well-being. This is a picture of the first time that I met my grandson. His name is AJ. This was the day after he was born. He's in the NICU, and he spent 6 weeks in NICU. He went to term, but he was very small when he was born. He was right around 4 pounds. He had some eating issues, and they couldn't keep his blood sugar up. He spent 6 weeks in NICU. And so what I got to watch was how a collective of very diverse folks worked with him. His name is AJ, worked with AJ. There were nurses. There were doctors. He had the most amazing grandparents in the world, of course. His parents, both of whom are doctors. Our son is a doctor of physical therapy, and our daughter-in-law is a doctor of pharmacology. Lab technicians, dietitians, radiologists, all these folks working together. And if you have never seen the operation of NICU, I think NICU nurses need to be in the class of first responders and elevated as real heroes, because they do some amazing, amazing stuff, and they deal with some very, very difficult cases. Anyway, AJ spent 6 weeks in NICU, and what I got to watch was this collective of very unique individuals all work together with the sole purpose of helping AJ become well. That's what their focus was. It didn't matter what their discipline was. It didn't matter what their expertise was. It didn't matter whether they were a doctor or a nurse or a nutritionist or whatever. All they were focused on collectively was helping AJ become well. And that's the result. This is a picture some months after AJ left NICU. I can attest to the fact that he is a thriving and healthy 2.5-year-old right now and growing amazingly. But again, for me, the personal testimony is to watch how that team of folks across disciplines, I mean, obviously all in the medical field, but across various disciplines, came together and really helped him become well. And this was all happening around the time we were promoting this notion of well-being, so it really resonated with me that we need to think about this notion, again, from a holistic, collective perspective and not get locked into silos of disciplines that we operate in.
And I do just want to note for the folks on the phone that, Lyman's talked a lot about how they're putting out the next iteration of this. And Lyman, it was really a pleasure to hear you again, and I look forward to our continuing partnership.
And thanks everybody for your time and for listening in.